Bill George has always had a desire to build something that could make a difference in the world. When he was named president and COO of Medtronic in 1989, he set out to fulfill that dream. By the time Bill retired in 2002, he had taken a $750 million heart device manufacturer and transformed it into a $6.4 billion global medical technology company.
I was passionate about the mission, the values of the company, almost from day one, from the time Earl Bakken spent a whole evening describing them to me. It was interesting enough when Earl interviewed me for the job. He never actually interviewed me. He just wanted to talk about the mission, and he wanted to talk about the values. He wanted to see if I got it. And I must have passed the test because I got the job. And I can tell you it was the best 13 years of my life. But if I hadn't gone through that difficult time at Honeywell, what I call a crucible, where I was really losing my way and focusing more on a title than on the work I was doing, and I was focusing more on taking things apart than building things, I don't think I ever would have closed the door of Honeywell behind me and walked into Medtronic stores.
Bill turned down 3 jobs at Medtronic before he agreed to join the company in 1989. While he had gained plenty of business and high-tech experience from various leadership roles at Honeywell and Litton Industries, he had 0 experience in medicine.
So I gowned up and saw some 700 to 1,000 procedures over 12 years, putting on the greens, meeting with a doctor, watching open heart surgery, watching a brain surgery, looking at a defibrillator being implanted, angioplasty, whatever it was. And that really made a huge impact. And I would never say that I knew a fraction of what the doctors did or could give them any advice, but it got us focused on the unmet medical needs that patients had and how could Medtronic use its technology to meet those needs.
Instilling a focused and disciplined product development team was key to meeting those unmet medical needs as well as growing the company.
We actually cut the lead times on new products coming to market from 48 months to 18 months. And that changed the entire game in our industry because we went from being a technology follower to the technology leader.
Unfortunately, it wasn't always that simple. By 1998, growth had really slowed down as competitive products entered the market, and new products Medtronic had in cycle wouldn't be ready for another year or 2. That left Bill with 2 choices.
We either had to shrink as a company or be bold and go for it. And we elected to be bold and go for it, and we acquired 4 or 5 major companies that transformed the company forever from what was a pacemaker defibrillator company into the world's leading medical technology company.
Within about a year, Medtronic spent $13 billion on acquisitions, giving the company capabilities in spinal and heart surgery and diabetes treatment. As a result, the number of employees and the shareholder value doubled in 2 years. When he arrived, Medtronic employed about 4,700 people. When he left in 2002, the company employed about 26,000. During his tenure, Bill also helped Medtronic achieve more than 18% compound growth in revenues.
I think the thing I'm proudest of from my days at Medtronic is that when I arrived at the company, we were restoring 300,000 people a year to full life and health through alleviating pain, restoring health, and extending life. When I left, that number had grown to 6 million. Today, thanks to acquisitions and tremendous internal growth, it's more like 60 million.
Bill retired from Medtronic as CEO in 2001, remaining chairman for an additional year. Upon his departure, he became a teacher. Today, he teaches part-time at Harvard, where he continues to make a difference and inspire others.
I found I really love teaching and working with young people where their whole future is in front of them. See, great leaders don't lead just with their brain, just with their head, if you will. They have to lead with their heart. Because the qualities that make a difference in a leader are not IQ, but EQ, emotional intelligence. It's self-awareness. It's having good social skills. But it's also having a sense of passion for the work, compassion for the customers you serve, empathy for the employees you work with, and most important of all, having the courage to make a difference, to make big, bold moves.